Hey guys, so Malia's here with us today, and she's here to talk about schizophrenia. What's up? Wow, that was schizophrenia and what's up? Don't usually go together, but today they do. Let's go. All right. So, Malia, can you please tell us what is schizophrenia?
Schizophrenia, oftentimes the most common symptoms are hearing voices or having some kind of hallucination, which can be tactile, which would mean like you would feel something when no one's there, hear things, you would have voices in your head, you could even smell things that aren't there.
Not to make light of it, actually, schizophrenia is a very serious thing, and having those hallucinations. Can you even imagine going throughout your day and like you can't get anything done, you can't focus because like there are things that aren't real that are messing with your head, and it's just I don't have schizophrenia, but I can only imagine like, how tough that would be.
Oh, I forgot to mention delusions too. So delusions could be you feel like your friend Steve is an alien.
She knows!
If it's true, it's not a delusion, but...
Well, you know, but there are delusions though, and that actually is a serious problem. Again, not to make light of it. So can you please tell us then, what does it feel like to have schizophrenia?
For the most part, it feels normal. And there's only, for me, I've only had a few, it only comes up maybe once a year. It's not something that is 24/7. For me at least, it's not 24/7, seeing things, feeling things, hearing things. It only comes up every now and then, and there was a month in my life where it was pretty bad. I had to be in the hospital, but for the most part, it's not like it's always happening.
I think that's an interesting point. I feel like we view schizophrenia as something that like someone battles with like on a daily, like they're always hallucinating, always having delusions. Does that happen? Like, are there people who suffer with it like 24/7, or is it more common to find someone that has it like on and off?
So, in my experience with other individuals who have schizophrenia, there is a spectrum. So I would say that I'm pretty lucky that my symptoms aren't constant. They're every now and then. But I have actually met a lot of other individuals who are similar to me, especially if they're on their meds, where it's not something that is a constant thing that they deal with. And on the other hand, on the other side of the extreme, there are individuals who, you know, it is a constant thing. Like my uncle would be more on the severe end of the spectrum. And I think that's the example most people think about when they think about schizophrenia, but it's not true. There's this whole spectrum of symptoms and how often they affect you.
So I think that brings up a good point about perspective, and that the way that we look at something can be totally wrong and totally off, or sometimes even truthful. So can you please tell us what are some of the misconceptions or stereotypes people have had against you? You know, like, do they come up and like, can you see me right now? Like, does that happen? Like, what are some of those types of things?
The main misconception is that you think someone with schizophrenia can't work, they're going to be homeless, they're going to be yelling to themselves, they can't go to school. And when I was first diagnosed, that's kind of what I thought, because that's what I had seen on TV and documentaries about schizophrenia. In my own family, that's what I've seen, and so that's what I expected to happen, but it didn't. And there's a lot of my friends who have schizophrenia too, and who are, you know, did go to college and are working full-time and making money, so you can still have a good life.
Yeah. One of the things that you said to me earlier was that there's actually like a large group of people with schizophrenia that are successful and are doing well, and even I was kind of surprised to hear that. You know, I thought, of course I know that there are people like yourself who have recovered and are doing very well in managing a successful life. However, I didn't realize that there's such a large population of it, and I guess that furthers the stereotype of schizophrenia. Malia, can you tell us one of the more severe ways that schizophrenia has impacted your life? Like, how has it really hit home for you?
One of the delusions that I had that most impacted my life is that I felt if I touched or opened my textbooks in college, that my limbs would fall off. And I was an English major, so I wouldn't read any of my books. I stopped going to school. It was hard for me to get out of bed, so I just kind of laid in bed and didn't eat very much, didn't do my work, and then I also eventually felt suicidal and ended up in the hospital where I heard my name called. There was no one there. Yeah, it was very close to ruining my life, but I fought against it.
My final question for you is going to be, what are some things that someone can do, or that anyone can do, if they know someone with schizophrenia, if they themselves have schizophrenia, whatever the spectrum, what are some of the helpful coping mechanisms or treatment methods, whatever you want to talk about? I'd like to hear your opinion on it.
Sure. So when my symptoms got really bad, it's because I didn't have a support system. So when you're all alone, you're isolating, you don't have friends or family around, definitely if you have schizophrenia, your symptoms will worsen. And so having a support system is so important. Having people who are there for you, who believe in you, who push you to achieve things, go to school, get a job, even though you may not think you want to or you can. Surrounding yourself with those individuals. When I had my worst episode, it really helped me to go to my mental health campus or mental health center at school and talk to my therapist. She was really a great support to me when I didn't have anyone else. And then also my antidepressants have really helped. The doctor put me on way more medicine than made me feel like me, so I felt like a zombie, but I found the one that works for me and don't take the ones that made me feel a zombie, and that definitely helps. I would say therapy, the meds, whatever works for you, and having a good support system, having my family and friends and my husband is so very helpful.
She's taken. Did you hear that? She's taken. Okay. Really quick though, before we end, I want to just clarify, we're talking delusions. They may seem silly, I'm an alien, or that my limbs are going to fall off if I open a book, but for the person, the whole reason that they exist, delusions are real to the person that thinks them. Can you imagine living your life where you honest to God believe, where it is clear as day, if you open a book, your limb's going to fall off? That's what a delusion is. It's not something that's to be taken lightly, or it's not something that, no one half-asses a delusion. It's real. So don't be afraid to reach out, because you don't have to suffer with schizophrenia or with anything. So, anyways. Don't do anything the unicorn wouldn't do. See you guys next time.
I want the unicorn instead of Stitch, but you called it first, so.
It's okay. You could just bring out Stitch and fly into the air. Be like, did you see that? It wasn't actually there. I might put that part at the end.